The role of a general practice nurse is varied. It's one of the most exciting jobs that you can have, I feel, in nursing, because you have everything from birth to death. You don't know what's going to be coming through the door. You can come into general practice and be what we call a general practice nurse, and that's what we call treatment room nurse. And that's anything from doing blood pressures, ear syringing, dressings, leg ulcers or other dressings, doing smears, doing immunisations, doing a lot of what I call public health work as well.
No 2 days are ever the same, which is one of the interesting things and challenging things about the job. I specialise in respiratory disease here. Each of the nurses has a different specialist area, so I can be running an asthma clinic and doing routine planned care for people with asthma, or indeed seeing people who are undergoing, who have a flare-up of their condition, so acute management.
There are misconceptions about practice nursing in so much as the role you can feel isolated. You do work on your own, and a lot of nurses feel that they do not get enough protected time for their education and for development. However, in hindsight, this has changed a great deal over the years. We have a lot of support from the Practice Nurse Association, which is run by Royal College of Nursing. Also, there's a Practice Nurse Forum, which you can access online. So there is a lot of support in place.
There's also another area around practice nursing that I think some people maybe not be aware of. And it is actually one of the only places I feel that you can really do some flexible hour and working, because surgeries now are predominantly open from 7 in the morning till maybe 7, 8 at night. So there's the opportunity there for some nurses perhaps to do job shares, to do sort of mornings or afternoons. A lot of practice nurses actually do part-time work, and there's a lot of practice nurses out there like myself that also do full-time work, but the opportunity is there.
As a practice nurse, you undertake a wide variety of roles and can see patients right across the age spectrum, from young children and babies doing immunisations right through to older people, potentially end-of-life care as well, and can gain an in-depth knowledge of long-term conditions such as coronary heart disease, respiratory conditions such as asthma and COPD.
What I enjoy about practice nursing is I get to know the whole family, and it's on a one-to-one basis, and it spans over all those years as well, from 0 to 100, and it's very rewarding to watch people grow. As well as sickness, we do deal with health prevention and cure, so it's nice that you do the promotion of health. So that is rewarding, more than just dealing with someone that's maybe unwell and there's not much positive coming out, but there is a lot of positivity with our role as well. Practice nursing is a very rewarding, very stimulating career, because I find that the family do come in and they always ask for you. The continuity of care is very important to a lot of people, and being able to see that same person all the time makes a great difference in their lives, more than seeing strangers, and you build up that relationship.
I would say if anybody was interested in a career in practice nursing, I would definitely suggest getting in contact with a local practice and going to spend some time there to find out a little bit about what the job involves. It's very, very different from any other role in nursing I've found, but equally it's a very interesting and challenging role.